Welcome to this educational video where we'll explore a rare and intriguing condition affecting the urinary system, urethral melanosis. We'll delve into what this condition is, its potential causes, how it develops, and what can be done about it. While relatively uncommon, understanding urethral melanosis is crucial for both healthcare professionals and anyone interested in learning more about urological health. The exact cause of urethral melanosis remains somewhat elusive, but several factors are believed to contribute. At its core, it involves an increase in melanocytes, the pigment-producing cells, within the urethral lining. This can be triggered by chronic inflammation or irritation, possibly stemming from recurrent urinary tract infections, exposure to certain chemicals or medications, or even physical trauma to the area. Genetic predisposition may also play a role, making some individuals more susceptible to developing urethral melanosis than others. More research is needed to fully unravel the complex interplay of factors leading to this condition. Urethral melanosis arises when melanocytes, located in the basal layer of the urethral epithelium, begin to proliferate abnormally. These melanocytes then deposit excessive amounts of melanin pigment within the surrounding cells. This leads to the characteristic dark pigmentation of the urethral tissue. The melanosis can manifest as either solitary or multiple, flat or slightly raised, pigmented macules or patches along the length of the urethra. The depth of the pigmentation depends on the amount of melanin deposited. In some cases, melanin-laden macrophages, immune cells that engulf melanin, may also be present in the underlying connective tissue. Due to its rarity, accurate data on the epidemiology of urethral melanosis is limited. It's generally considered an uncommon condition, more often reported in adult males than females. However, this may be partially attributed to the fact that the male urethra is longer and more accessible for visual examination. The condition has been reported across various ethnicities, suggesting that it doesn't discriminate based on race. More extensive epidemiological studies are required to better understand the true prevalence and distribution of urethral melanosis within the general population. In many cases, urethral melanosis is asymptomatic and discovered incidentally during routine medical examinations or procedures. However, when symptoms do occur, they can vary depending on the location and extent of the melanosis. Some individuals may experience changes in urinary stream, such as hesitancy or weak flow, particularly if the pigmentation causes any degree of urethral stricture. Pain or discomfort during urination, known as dysuria, is another possible symptom. In rare instances, patients may notice blood in their urine or hematuria. It is important to note that these symptoms are nonspecific and can be associated with other urological conditions, warranting a thorough medical evaluation. Diagnosis of urethral melanosis typically involves a combination of clinical examination, imaging studies, and tissue biopsy. A healthcare provider will begin with a detailed medical history and physical examination, paying close attention to any relevant symptoms. Visual inspection of the urethral opening may reveal areas of dark pigmentation. Urethroscopy, a procedure that involves inserting a thin, flexible tube with a camera into the urethra, allows for a more comprehensive visualization of the urethral lining. The gold standard for confirming the diagnosis is a biopsy, where a small tissue sample is taken from the pigmented area and examined under a microscope by a pathologist. This helps to differentiate urethral melanosis from other conditions, such as melanoma, which can also cause pigmentation but is a more serious form of cancer. Urethral melanosis does not have distinct classifications or types beyond descriptive terms based on the appearance of the lesions. For instance, the lesions may be described as macules of flat spots or patches, solitary or multiple, or by their location within the urethra. Some cases may be associated with lentigens, which are small, sharply circumscribed pigmented spots. These descriptors are useful in characterizing the presentation of urethral melanosis but don't represent different types of the disease itself. The management of urethral melanosis depends largely on the presence and severity of symptoms, as well as the exclusion of other, more serious conditions. In asymptomatic cases, particularly when the diagnosis is confirmed through biopsy and there's no suspicion of malignancy, observation may be the only necessary course of action. Regular follow-up appointments are recommended to monitor for any changes. If symptoms are present, treatment may include topical medications, such as steroid creams, to reduce inflammation. In more severe cases, surgical removal of the pigmented area may be considered. Laser therapy is another potential treatment modality that can be used to destroy the melanocytes and reduce the pigmentation. Currently, there are no specific preventive measures for urethral melanosis, primarily because the underlying causes are not fully understood. However, Maintaining good urinary hygiene and promptly treating any urinary tract infections may help to minimize potential irritation or inflammation that could contribute to its development. Avoiding exposure to known irritants that may affect the urethra is also advisable. Since genetic factors might play a role, individuals with a family history of pigmented lesions or urological conditions may consider discussing their risk with a healthcare provider. The prognosis for urethral melanosis is generally excellent, especially when the diagnosis is confirmed as benign and there are no concerning features suggesting malignancy. In most cases, the condition is stable and doesn't pose a significant threat to health. Recent research focuses on improving diagnostic techniques to differentiate urethral melanosis from melanoma of the urethra, which is a rare but aggressive cancer. Additionally, studies are exploring the role of specific genetic markers and inflammatory pathways in the development of urethral melanosis, with the goal of identifying potential targets for future therapies. Further research is also needed to refine treatment approaches and minimize the risk of recurrence after surgical intervention.